I'd like to introduce to you our keynote address from Debra Fraser-Howze. And she is an amazing public health pioneer. Debra is known for connecting the cure with the community. She is the principal of D. Fraser-Howze and Associates, which is a private consulting firm advising corporate clients seeking to develop business in new markets and that benefit public health and communities of color. And Debra Fraser-Howze has been widely recognized for more than 4 decades as a global leadership to communities of color regarding teenage pregnancy, social welfare, and HIV and AIDS. Debra served on presidential advisory councils for AIDS under 3 presidential administrations. And she was the founder and CEO of the National Black Leadership Commission on AIDS, and then became the senior vice president of external and global affairs for OraSure Technologies. I call her my big sister. I present to you Debra Fraser-Howze. Thank you for being with us, Debra.
Thank you, LaJoyce. Thank you for having me. Thank you, everyone. I'm always happy to be with the family. I've been to the White House, I've been to the outhouse, but it's our house that I am most comfortable in. And I feel honored to have been asked to come and speak with you today. As LaJoyce said, my little sister, you know, you get family, you have family all the time, the family that God gives you, and then there's the family that you get to choose. Some of y'all like that other family better, but trust me, all the family is all together for good. You have to love all your family. And I certainly do love LaJoyce. I am going to be talking to you very technically. And then I'm going to end with just giving you some personal information. But what I want you to hear as I'm talking to you from a public health standpoint is what these numbers mean. When I talk about these numbers and give you this public health data, I want you to understand that these are human beings. The people, the numbers, the people that I'm talking about are you and me, my mother and father and children and grandchildren and your nieces and nephews and aunts and uncles. These are the people in our community. These are our people. I'm going to talk to you a little bit about COVID. What is this thing? Since early March of 2020, just a few months ago, this novel coronavirus, SARS-CoV-19, the president may be a little confused about what the 19 means. It means that it was discovered in 2019. And it's one of a series of coronaviruses, like SARS is a coronavirus. And it's spread throughout the United States and has taken a cruel and direct aim at a very vulnerable Black community. We represent about 13.4% of the American population, according to census numbers, and we're almost 60% of the deaths from COVID-19 cases. An analysis was done on 40 states and the District of Columbia that was just released. And it found that Black Americans are more than twice as likely as whites, Latinos, and Asian Americans to die from the coronavirus. Another analysis, and it's talked about how our death rate is above other communities. We account for a higher share of confirmed cases, just infections, in 20 of 31 states, and of deaths in 19 of 24 states. We are unusually high in our percentages in Wisconsin, where Black people make up 4 times higher share of confirmed cases, 25% of the confirmed cases to our 6% of the population. The same in Kansas, where we account for 3 times a higher share of cases, 17% of the cases with 6% of the population. And in some places, over 5 times our population in comparison with the number of deaths. Other states where our share of death was at least twice as high as our share of the population include Illinois, Michigan, Missouri, Arkansas, and Indiana. Moreover, Black people accounted for over half of all deaths in Washington, D.C., 75%, Mississippi, 66%, Louisiana, 59%, Alabama, 52%, and Georgia, 51%. Now, I want you to understand that these numbers are our people. They're not just numbers. Why is there this disparity among our people? Why are we getting so much of this, and why are we dying at a greater rate than anybody else? Why is it that in Chicago, where Black people are 30% of the population, they comprise 70% of the people who have been killed by COVID-19? One of the reasons is that this epidemic, this pandemic, as will every pandemic, like the epidemic of AIDS, every worldwide pandemic will come and hit us harder than it hits anybody else. Why? You know, believe it or not, some of it has to do with the legacy of how we were treated during slavery. When people talk about reparations, our health is one of the things that suffered the most. And it's not just because what we ate. I mean, we learned how to make ham hocks and lima beans. We learned how to use the scraps that they gave us. So it's not just our nutrition, though. Our nutrition played a great part. And while we're not the healthiest, but we also had collard greens, we had okra, we understood what to do to try to save ourselves on that level, even without, and you know, always in lack. But we were also beaten and raped and worked to death. And somebody owes us something for that. So when we talk about dancing through the storm that is COVID-19, I want us to always keep in mind, somebody owes us something for that. Because that was wrong. And it has landed us where we are today. Now, there's another wide range of theories of why we're in such trouble with this thing. But you know, it was H. Rap Brown, I'm sure, that said this. Somebody told me the other day it was the Urban League, but I'm sure it wasn't the Urban League, that said when white America gets a cold, Black America gets pneumonia. I'm old. I remember, I'm quite sure that was H. Rap Brown that said that. But the saying is correct. When they get a cold, we get pneumonia. And it captures the range of racial disparities across all sectors of American society, and is reflective of poor health outcomes for our community. There are a number of studies that have been done with compelling evidence, you know, starting with studies that have gone way back during our Jim Crow days, you know, to ask why is it that we're not doing well. And one of the studies, it was called the Unequal Treatment by the Institute of Medicine. And this was an interesting study because in this study, it was in 2002, and Congress commissioned it, and they went back to all the years of all the studies that said Black people are sicker than all people, and why are they sicker than all people, and what's going on with their health, and how come we can't get their health together. They looked at a large body of public research, and this report never got the attention that it was supposed to get. But for me, as somebody who works in health and public health, and specifically in infectious disease and disease prevention, This study, for me, said it all. And I'm just going to read you the conclusion of all these scientists that looked at all the studies and put them together. They said that a large body of public research reveals that racial and ethnic minorities experience a lower quality of health services and are less likely to receive even routine medical procedures than white Americans. Relative to whites, Blacks, and in some cases Hispanics, are less likely to receive appropriate cardiac medication. We are less likely to undergo coronary artery bypass when our hearts are stopping. We are less likely to receive dialysis when our kidneys don't work or kidney transplantation. We are more likely to receive a lower quality of basic clinical services, such as intensive care, think COVID and intensive care and what's going on in the hospitals right now, even when variations in such factors as insurance status, which means even when we have the same insurance, even when we have the same income, even when we're in the same age group, have the same comorbid conditions, even when we walk into the doctor's office with expressing the same symptoms, we will have significantly less care because of the color of our skins. And the difference in that care is what causes greater death among African-American patients. So we've got a lot of conspiracy theories going on around this COVID thing. One was the melanin in our skin was going to prevent us from getting COVID. Well, we figured out recently that that's not the case. Another was the 5G satellite towers radiating disease in targeted zip codes. I don't know anything about 5G. But that is part of what people see as this grand conspiracy. Another one that I've heard recently is that Bill Gates is advancing population control with the government. But I'm going to say something to you, family, which is the same thing I said about AIDS. It don't matter how we got it. We got it. And just because we paranoid does not mean that people are not trying to kill us. This is something that Jesse Jackson taught me many, many years ago. And therefore, we have to be on guard. We have to hold up the armor of God and be very, very clear that we have to take control of our health and we have to stay alive. Let me tell you one thing that happened to me. Some years ago, I frequent Africa. And on one of my many trips to Senegal, every time I go to Senegal, actually, I go to the door of no return. For those of you who do not know, and most of you do because this is my family and I know how well versed you all are. The door of no return is an amazing situation. It's the fort where they took us to put us on the boats to send us over. In chains, many of us throwing ourselves on the rocks. All you can see when you go to the door of no return is the Atlantic Ocean. All you see is the ocean, nothing else. Many of us threw ourselves down because we refused to go into slavery and would rather die first. There is a griot, and if you can see this picture behind me, it's the picture of a griot, which is a storyteller in Africa. There's a griot that comes out at the door of no return every time we come home. And somebody is saying in the pink sand, it's just wonderful. Africa is a wonderful place. The griot came out all in gold robe and headdress. There was about 100 African-American leaders that had gone this time, and I was there with Dick Gregory and Jesse Jackson and several other Black leaders. And the griot came out and he said, "Welcome home. I'm so glad to see you. We knew that you would return. one day. And then he went on to say that somebody, from the day they took you from us, somebody comes here and prays for you every single day for 400 years. Somebody in Africa has been praying for us. And he said, and we knew that you would come home because they did not take the weakest of us. They did not take those of us who were broken or ill or old. They took our strongest, our wisest. They took our scientists. They took our doctors. They took our warriors. They took our virgins. They took our queens and our kings and our princes. They took the best of us and put you on a boat and sent you away. And we knew you would come home because we knew that you would find your way home because you were the best of us. So how do we dance in the storm of COVID? We find our way home because we are the best of them. And we owe it to them to stay alive so that we can be home and we can be here and we can be with our families and we can raise our children because our children are the best of them. Dance through the storm, family. Wear your masks, clean your hands, do whatever it is you need to. Don't listen to these people telling you don't wear masks, don't clean your hands. Don't listen to that. And if other people want to go to rallies and not wear masks and spit in each other's face, and let them go. But you, Black community, you stay home. You stay alive. Many of us are working in jobs where we have to interface with the public. Protect yourself. Why? Because somewhere along the line, in all of who we are and what we have, we let some piece of society put their knee in our neck and choke the life out of us. We cannot allow that to continue to happen. And we cannot let COVID or any other disease take us out. Blessings to all of you, family. I'm giving you back to my little sister, LaJoyce. Have a wonderful, wonderful time at this wellness seminar. She's put together a wonderful, amazing program for us that's going to help us stay alive. Ashe. No sound, LaJoyce.
All right. Okay, great. Fantastic. Thank you, Debra, so much. You know, one of the questions that I have, Debra, now that racism has been declared a public health issue, what are we to do with it?
Well, you know, when you talk about reparations and what it is we need, I think that we as a community need to come together and figure out what that means around public health and our health. We have an Office of Minority Health. We have several, you know, Health and Human Services. We have several agencies that we are so far removed from that are giving out millions and billions of dollars to other communities for our health, you know, to either monitor our health, surveillance on our health, test for our health. It's time that we see part of the reparations is giving it to our own community so that we can decide how, when, and where we take care of our own health. And I know that you have a lot of doctors that are going to be a part of this, this webinar series. And I think it's critical for us, you know, at the end of these things, we don't want to just walk away and say we had a good time and we had a you know, good discussion. So at the end of this, the end of wherever I speak, I always tell people to do some action.
That's right.
So I'm going to leave with the call to action that we, the family, come together with some recommendations of what it is we're going to be asking for. Because if we don't ask now, this time may never come again. We can't let all of these young brothers and sisters die for nothing. We have to take this opportunity to ask for what we want and demand it, but it's got to be the right thing. So we've got to, somewhere at the end of this, I want people to put together recommendations and say, reparations for public health. What is in that? What do we need to make us whole again and healthy again, so that we're not susceptible to every disease that comes about? So that's something I want to give back to the community. Do we need to have natural medicine as part of our understanding? Does it need to be community-based? Do we need to have a natural medicine store on every corner instead of a liquor store? I mean, now is the time, you know, they can keep the vapes, they can do whatever else they want with some of this stuff. This is what we want. We want fresh food in our communities. We want to be able to grow food, and we want to have organic foods, and we have foods brought in. We don't want this bad stuff that's in some of these supermarkets. These are all of the things that we need to put together and tell the government, and one other piece of this, what we want. The other thing that we have to do is vote. We have to have people in office that's going to listen to us. And if we've learned nothing from watching this administration, we have learned the power of the presidency and the power of the Congress. And we have learned that when they want to, they can have trillion-dollar packages built up and dealt with overnight to give to whomever they choose. If they want to, they can push a button and say yes to this and no to that, and they just keep it moving. We should know by now that it is critical for us to put our people in office, the people that we can trust, so that when the revolution does come down, we have the right people in the right seats.
Come on. Absolutely. I think what you're saying here is critical, because we must be in a position, place ourselves in a position of power. We have to know what the ask is. Yes. And the more people who are asking the exact same thing, we're more likely to get it. Tell us, Deborah, how we do that. How we expect that kind of change.
The more people who are asking the same thing, the right thing. You know, some people that may be listening, I've got friends, Ernest Hopkins, Cornelius, and you know, we got together at one point and wrote a piece of legislation called the Minority AIDS Initiative. It was the first piece of legislation written by Black people that actually put money in the Black community for AIDS education and services. We learned that when they give out the pens in Congress, they give Black people the same pens. So we got to learn how to write with those pens and learn the system enough to go in there. We have a Congressional Black Caucus. There's some great people in the Congressional Black Caucus, great minds that are in there. And a lot of them are warriors. We need to just give them what it is they need to take forward with pieces of legislation and make it happen. But that means that we got to vote.
That's exactly what that means. Mm-hmm. What are you saying? Please speak to the people who may be on the fence and feeling that their vote doesn't matter. Didn't we learn that lesson once already?
We learned that lesson this time. You know, we came out and voted for Obama. We did not come out and vote in the same numbers. And through some trickery called the Electoral College, even though—
No, you didn't call it trickery.
Yeah, it's trickery. Even though Hillary Clinton got 3 million more votes, we wound up with President Trump. Now, a lot of us like President Trump. And, you know, that's interesting. What I say is that we need to stop focusing on who's in the White House and start focusing on what's going on in the White House, what they're doing. I, for one, can't tell you the number of executive orders that the president has signed. I don't know what they say. I think that one of the things that we're going to have to do immediately when this term is over is figure all of that out. But I say that the protests that are going on, the young people that are in the streets, don't ignore them. We need to support them, because it is my generation that has failed. And I came out of the 60s revolution and civil rights. And when I was coming up, I remember drinking out of the colored only water fountain in Charleston, South Carolina. I remember all of that. And I remember all of what we finally did achieve. But somewhere along the line, we got complacent. And we thought that our vote didn't count much. And we just stayed home. We can't do that anymore.
No.
We can never let this happen again.
I think that the youngsters these days, they're not going to allow that. They're not going back to doing something like drinking out of a colored only fountain. They are far too radical. They are coming from an impassioned and informed position, and it's just not going to happen.
Yeah, the young people are great, and the young people of all colors. I mean, we've got a coalition going on. In the 60s, we had a coalition of many people of many colors. But right now, we've got a coalition going on like one I've not seen before. And I am so happy because just like the griot in Africa, the Black Lives Matter kids and all of these kids have got these organizations going. They come from the best of us.
Yes.
And look at what they're doing. This is what happens when the best of us rises. And we have to continue to support them.
Debra, how are we going to overcome from the trauma of seeing Black people just killed in the streets?
So the other piece of information that the family, some of the family already know that the family needs to know is that in all of what I've done and all of my service to the community, I came home one day and found out that the police had shot my son to death. And LaJoyce, you were right there with me. So, you know, it was a horrific,
awful, worst experience. Day.
And I am one of a cadre of mothers in a special club that no mother ever wants to be a part of. My son Barron was a wonderful, wonderful 25-year-old unarmed man killed by the police in his car. This is what I've got to say. The wounds will never go away. We're not going to be able to get over it. But just like the title of my discussion is, how do we dance through the storm? We have to get through it, because it then becomes our responsibility to ensure that not another child, not another person is ever killed like this again. And believe me, the images that I see every day on television and the news, it takes a piece of my heart each time. I'm bleeding inside. But I know I have to get up in the morning. I have to go write a proposal. I have to talk to some members of Congress. I have to ensure that we're being protected. I have to look at the death records from COVID. I had to fight. I had to ensure that we were able to produce a Ebola test when Ebola was raging in Africa. I had to ensure that we had a Zika test for South America when our babies were being born with a disease. I had to get up. And we have to get up, because I'm not going to be here forever. But somebody will be here. And we're going to have to figure it out. We're going to have to pull ourselves up, get back on the horse, and ride in the revolution. And that's how we survive. I survived for my son, and I survive for all of the sons and daughters, the women who were shot in their homes, in their beds, the sons who are walking down the street with a soda pop and a bag of Skittles. Somebody who's jogging in the street and some white men just decide they're gonna corral him like an animal and shoot him down. Brothers in South Carolina getting shot in the back and guns planted on them. I have lived this nightmare personally, and I am telling you that it is part of what is killing us.
Yes. Oh, yes.
It is the knee in our neck, and we have to make it stop. And we are going to make it stop because we have no choice. Because the griot said, we are part of the best of them.
Yes.
And we have to remember that in every walk in life. We are the best of them. And no matter what they do to us, they will not destroy us.
That's right. We're built to last. That's why.
Built to last.
Keep getting up. Keep getting up. Well, Debra, I want to thank you for joining us. I want to thank you for being here. You had some amazing comments. Everybody's talking about how transparent you are and how you're an inspiration. And indeed, you continue to be an inspiration to me, and you are an inspiration to us all.
God bless you, family. Ashe, I love you.
God bless you. Yes. Thank you. And that is how we begin the Wellness Warriors Weekend.